Most men think quitting is harmless. But after 60, it can secretly harm your body in 4 shocking ways. You've never heard this before. Giving up self-pleasure after 60 can trigger health risks no one talks about. What happens if you stop masturbating after 60? I'll reveal the 4 risks your doctor probably hasn't told you. Men over 60, ignoring this one habit could make you weaker, sicker, and even sadder. Let's talk about it. You'd expect stopping to be good for your health. But the truth is, after 60, it can backfire in 4 dangerous ways. Let me be direct with you, because this is something almost no doctor will ever tell you in a standard checkup. But it could be silently changing your health as we speak. If you've stopped touching yourself in your later years, or maybe you never really gave it much thought, your body may already be paying the price without you even realizing it. Now, I know what you might be thinking. Dr. Elena, isn't this kind of a private, even taboo subject? And trust me, I get it. But what I'm about to share with you has nothing to do with locker room talk or youthful curiosity. This is a medical reality, supported by decades of research and years of clinical practice. And here's the part nobody warns you about. Neglecting this one natural function can affect far more than your sexual health. It can influence your prostate, your brain, your sleep, your immune system, even your sense of independence and identity. I'm Dr. Elena, and welcome to Desire and Energy After 50, where we uncover the truths about aging with vitality, intimacy, and strength. I've spent my career guiding men and women over 50 toward not just living longer, but living better. And I want you to know, this topic is far too important to stay in the shadows. Because what we're really talking about today is freedom, longevity, and feeling alive in your own skin. So let's dive right into the first, and often most ignored effect of giving up on your sexual self, especially self-pleasure as you age. 1. The silent decline of prostate and urinary health. When I first began treating older adults, I never imagined how often this topic would surface. Over the years, countless men, bright, strong, accomplished men, have sat across from me, quietly confessing they'd let go of intimacy in their lives. One man in particular stands out. He was in his early 70s, vibrant in many ways, but frustrated by one thing. Doctor, I don't understand why I'm up 5 times a night, struggling to urinate. What he didn't know, and what so many men don't know, is that the prostate is not a passive gland. It's a dynamic, active organ that depends on regular release to stay healthy. When ejaculation stops, fluid can stagnate inside, creating the perfect storm for inflammation, swelling, and congestion. And here's the real danger. This congestion doesn't just make bathroom trips more difficult or uncomfortable. It can set the stage for benign prostatic hyperplasia, BPH, chronic urinary retention, bladder infections, and even the need for catheterization or surgery later on. But here's the hopeful part. Research shows that men who maintain regular ejaculation, yes, even through masturbation, have a significantly lower risk of prostate cancer. That's not opinion. That's science. So when men give up this practice, they're not just giving up pleasure. They're giving up a protective mechanism for one of the most important organs in their body. And if you've ever felt embarrassed, restricted, or even fearful because your bladder seems to control your life, this is one area where taking back control is not only possible, but powerful. 2. Mental clarity and cognitive sharpness. Now, let's talk about something that hits even closer to home. Your brain. I'll never forget a patient in his late 60s who looked at me one day and said, "Doc, I don't feel like myself anymore. I used to be sharp as a tack, but now I walk into a room and forget why I'm there. I start a sentence and lose the words halfway." Sound familiar? Of course, aging brings some natural changes to cognition. But what most people don't realize is that sexual activity, even solo activity, triggers a powerful chemical orchestra in the brain: dopamine, serotonin, oxytocin. These aren't just feel-good hormones. They are the very chemicals that support focus, memory, emotional stability, and stress resilience. When you stop self-stimulating, your brain stops getting those regular boosts. Over time, that can translate into mental fog, reduced motivation, and even faster cognitive decline. And here's a critical link. Healthy sexual activity helps maintain testosterone balance in men and stable hormone levels in women. Testosterone is not just about libido, it's about energy, clarity, and your sense of drive. Without it, you don't just lose desire, you risk losing part of your identity. One of the most heartbreaking things I see is when people confuse this preventable mental dullness with just getting old. It's not inevitable, it's neglect. Before we move forward, if these insights are resonating with you, please take a moment to subscribe and hit the bell icon. That way you won't miss future videos where we get real about the science of aging well. And type a 1 in the comments if you're still with me. It shows me you value this message and want more of it. And this is only the beginning, because losing this connection with your body doesn't just affect your prostate or your brain. It can quietly shift your emotions, your sleep, your physical strength, and even your immune system. That's why in the next sections, I'm going to take you step by step through how neglecting self-pleasure increases your risk of depression and emotional numbness, why poor sleep in older age often ties back to lost intimacy, how your circulation, pelvic floor, and even your immunity are directly linked to sexual release, and ultimately, how reclaiming this connection may restore something even deeper, your sense of worth and vitality. Because let's be honest, aging is not about giving up who you are. It's about finding ways to stay alive in every sense of the word. 3. Emotional balance and depression. Now, let's shift gears and talk about something many people silently struggle with, but rarely connect to intimacy: emotional numbness. I once sat with a widower in his early 70s, strong in appearance, but hollow in his eyes. He said to me, "Doc, I don't feel anything anymore. Not joy, not sadness, just nothing. Is this normal for my age?" My heart broke when I heard that, because what he described isn't just aging. It's often the body quietly crying out for release, for connection. Here's the science. During climax, your brain floods with oxytocin and endorphins. These aren't just pleasure chemicals. They are natural antidepressants, biological mood stabilizers designed to soothe your nervous system, reduce anxiety, and bring balance back to your emotional world. But when that outlet disappears, especially in the face of stress, grief, or loneliness, something begins to fade. Life loses its spark. And depression in older adults doesn't always look like sadness. Sometimes it looks like irritability, or fatigue, or withdrawing from the hobbies and friendships that once gave you joy. One gentleman I worked with hadn't touched himself in years. After encouragement, he decided to try reconnecting with his body again. A month later, he came back and said, "I don't know how to explain it, Doc. I feel human again. Like something woke up inside me that I thought was gone forever." That is the power of self-intimacy. It's not about lust, it's about staying emotionally alive. And let me say this clearly, you are never too old to feel, to laugh, to cry, to experience passion, even if that passion is shared only between you and your own body. 4. Sleep and restoration. Now let's talk about one of the most frustrating issues my patients face: poor sleep. Maybe this sounds familiar. You fall asleep only to wake up at 2 or 3 in the morning, restless, staring at the ceiling, counting the hours until dawn. You try herbal teas, breathing apps, even prescription sleep aids, but nothing seems to bring that deep, uninterrupted rest you crave. What if I told you your body already has one of the most effective sleep remedies built in? Here's what happens during climax. Your body releases prolactin, oxytocin, and endorphins, a natural cocktail that calms the nervous system, lowers cortisol, slows your heart rate, and prepares your brain for restorative sleep. One of my patients, a man in his late 60s, had been exhausted for months. His tests came back normal, no apnea, no major medical issue. When I gently asked about his intimacy habits, he admitted, "That part of me is over, Doc." But that part of him wasn't over. It was exactly what his body was craving. After reintroducing self-intimacy, he came back weeks later and said, "I sleep like I did 30 years ago." And here's the truth. Without that natural release, your body may be missing a critical tool for sleep regulation. Instead, you're left with tossing, turning, irritability, and fatigue that spill into your days. And poor sleep isn't just an annoyance. It weakens immunity, increases risk of falls, clouds memory, and accelerates aging. But the good news is, sometimes the solution isn't in a pill bottle. It's in restoring a rhythm your body already knows. 5. pelvic floor and circulation. Now, let's move deeper, literally. At the very foundation of your body lies the pelvic floor, a group of muscles that support your bladder, bowels, and sexual organs. Most people never think about these muscles until something goes wrong. I'll share the story of a 70-year-old retired firefighter. Tough, disciplined, proud of his strength. But he came to me complaining of mild incontinence and aching hips. "Doc," he said, "it feels like my body's foundation is giving out." And he was right, because without regular stimulation, those pelvic muscles stop contracting. They weaken, blood flow slows, nerve responsiveness fades, and the result can be leaks, erectile dysfunction, constipation, even pain when walking or standing. Here's what's often overlooked. Masturbation is not just a release. It's a workout for your pelvic floor. Every contraction during arousal and climax strengthens those muscles, keeps nerves engaged, and pumps fresh blood to tissues that depend on it. So when older adults give this up, they're not just losing pleasure. They're losing strength, stability, and control over one of the most fundamental areas of independence. And let me tell you, the number of people who suffer in silence, believing it's just old age, is staggering. But it doesn't have to be that way. Reconnecting with your body is one of the simplest, safest, and most natural ways to preserve the very foundation of your health. 6. Immunity and illness. Now here's one of the most surprising effects of all, your immune system. A man in his late 60s once came to me complaining that every winter he seemed to catch every cold, every bug, and it took him weeks to recover. He said, "Doc, I used to bounce back in days. Now every little thing knocks me down." When I asked about his intimacy habits, he smiled sheepishly and admitted he hadn't touched himself in years. What he didn't realize is that sexual release is directly tied to immune health. During arousal and climax, your body produces immunoglobulin A, IgA, a powerful antibody that defends against viruses and bacteria. Endorphins also reduce inflammation and promote healing, and oxytocin helps regulate stress, which is one of the biggest immune suppressors there is. So when you cut intimacy out of your life, you're effectively weakening one of your body's natural defense systems. It's like taking the batteries out of your smoke detector. One woman in her 70s, who hadn't been intimate with herself since her husband passed, decided to try again after our conversation. Months later, she returned, saying, "I don't know how to explain it, I just feel stronger. Like my body is working with me again, not against me." And she was right. Because when you give your body what it was designed to receive, it responds with vitality. 7. Self-worth and identity. And finally, let's talk about perhaps the most important piece of all, your sense of self. I once had a former school principal, a man who used to command rooms with confidence, tell me, "Doc, I don't feel like I live in this body anymore. I feel like I just exist in it." That hit me hard, because I've heard versions of that story from so many men and women. They stop touching their body, stop looking in the mirror, stop caring for themselves, because they believe intimacy has no place in their later years. But here's the truth. Self-touch is not just about pleasure. It's about presence. It's about reminding your nervous system, "I am here. I am alive. This body still matters." When you lose that connection, something deeper than health begins to erode, your self-worth. You stop seeing yourself as vital, as attractive, as worthy of care. And over time, that belief shapes how you show up in the world. But when you reconnect, even gently, even slowly, something shifts. One woman told me, after resuming self-intimacy post-menopause, "I feel like I came back to myself, like I didn't disappear after all." That is the gift I want for you. Not shame, not secrecy, but wholeness. Reclaiming vitality. So let's bring this all together. When you let go of self-intimacy, you risk more than just missing out on pleasure. You risk prostate and urinary problems, brain fog and faster cognitive decline, emotional numbness and depression, restless, fragmented sleep, weakening of your pelvic floor and circulation, a compromised immune system, and perhaps most devastating of all, the slow erosion of your sense of self. But here's the good news. None of this is reversible. You don't need expensive medications. You don't need to be young. You don't need to meet anyone else's standards. What you need is permission, your own permission, to reconnect with your body, your health, and your vitality. Because later life intimacy is not indulgence. It is medicine. It is one of the simplest, most natural, most human ways to protect your health, your freedom, and your joy. So if you've pushed this part of yourself aside, I urge you, reconsider. Start small. Be gentle, but start. Because this is about far more than pleasure. This is about reclaiming the energy, resilience, and dignity that are rightfully yours. If this message resonated with you, please like this video, leave a comment, and share it with someone who might need to hear it. Your voice matters. And your story may help another person feel less alone. I'm Dr. Elena, and this is Desire and Energy After 50. Thank you for being here. Thank you for being open to truth. And most of all, thank you for choosing yourself.